All right. Hey everyone, welcome to our forensic psychiatry talk. I have the pleasure of having Dr. Reeves joining us. He wears many hats. He's the director of psychiatry at University Correctional Healthcare. He's also professor of psychiatry and forensic psychiatry training director at Rutgers Robert Wood Johnson Medical School. Dr. Reeves, we're really happy to have you here. We want to just allow our medical students to learn more about the exciting field of forensic psychiatry. We have a number of pre-submitted audience questions that we can run by you, or we can take questions live as they come up. But yeah, the floor is yours. What is forensic psychiatry?
Okay, I will answer. I will start with that question first. Thank you for having me. And again, let me give you just a little bit more of my bona fides. I'm Rusty Reeves. I am a professor in the Department of Psychiatry at Robert Wood Johnson Medical School, at part of Rutgers University. I am the training director of the Rutgers Forensic Psychiatry Fellowship. I'm also the creator of that fellowship. We have two fellows. Most of my work, however, is as director of psychiatry for Rutgers University Correctional Healthcare. We are an academic correctional affiliation, one of a few in the nation where we, the university, provide the medical and mental health care to New Jersey state prisoners. And I've been in that position since 2005, so I have a lot of particular correctional experience providing mental health care to New Jersey's prisoners. And for example, we have a very robust medication-assisted treatment program for opioid use disorder that I'm one of the principal authors of. I publish, I do research. I have a couple of grants that I'm working on to study outcomes of opioid use disorder patients who are leaving prison, and also a retention trial of Sublocade versus Vivitrol. But I'm kind of research light. I'm mainly an educator, but I wear a lot of hats, like you said. So I do a lot of different things, which means I'm not probably the world's foremost expert on any of them. I have only until 6 o'clock. I'm going to try to leave plenty of time for y'all to ask questions. I suggest if you've already got a list of pre-formatted ones, we probably, go through some of those that, Sebastian, I trust that you think would be most common. And then, if we run out of that, then we'll take calls from the field. Sebastian, you can pass along my email to people, I guess. They probably already, I don't know if they have it or not, but you can pass it along. If they have questions in general or about Rutgers. It's a pleasure to have all of y'all here. This is a long way away from a fellowship, but I got to plant these sorts of seeds early and to get to recruit people, and in turn you're going to learn a little about forensic psychiatry. I did send along two notes, two files. On one is Introduction to Forensic Psychiatry, another is an anonymized insanity and the competency to stand trial eval that I did. Okay. So Sebastian, you have those, right?
Yeah,
Okay.
so I sent them to everyone who filled out our Google form. But for anyone who hadn't done that, I just dropped them in the chat if you all would like to look through those documents.
Okay. So I'm going to start here with introduction to forensic psychiatry. I'm not going to just read on it, but I will follow it loosely. So the question that I was asked is, what is forensic psychiatry? Forensic psychiatry is a subspecialty of psychiatry that interfaces between practice of psychiatry and the law. And so the evaluations in forensic psychiatry, if it is classic forensic psychiatry, you relate psychiatric issues to legal issues. And you should know that this is not esoteric. A lot of work that we do in general psychiatry involves elements of forensic psychiatry, even if we don't call it such. So, for example, all the laws surrounding how we prescribe and who has authority to prescribe, and the Tarasoff duty that many states have, or duty to warn, where somebody poses a threat, imminent threat to others. Most states have these. That is part of forensic psychiatry because it's a legal obligation that requires psychiatrists to do something. There are also laws that sort of hem us in and say what we can do and what we can't do. And then when we ourselves are doing forensic psychiatry evaluations, it is for some legal purpose. The example that I included for you all is an old case that I've removed all the identifying details. I've changed ethnicity and names and so on. Uh, but it's a bread and butter case of competency to stand trial and insanity. These are, you know, basically sort of classic types of forensic exams. So um, uh, I'm going to talk about that in just a second. What I also want to tell you all is that you don't have to have a fellowship in forensic psychiatry in order to practice forensic psychiatry. Many of the older practitioners in forensic psychiatry never did a fellowship. I did, and I'm board certified. Nowadays, it is the preferred route into forensic psychiatry. Everybody knows the fellowship's available, and you're going to get more work if you've done a fellowship. And frankly, you're going to be better trained and a better forensic psychiatrist by doing a 1-year fellowship in it. But again, you don't have to do the fellowship. And you can even testify and not do a fellowship. But again, you get more experience if you do a fellowship. A fellowship is a 1-year experience after you do 4 years of residency. Now, some people do the 3 years of residency, do a child fellowship, and then do forensic. That's fine too. But you have to otherwise do 4 years of residency. It's not like a child fellowship where you can do 3 years of residency and then do 2 years of child. You got to do the 4 full years, and then you do a 1 year of the forensic psychiatry fellowship. So there are 3 broad areas for forensic psychiatry. You have civil law, you have criminal law, and then you have correctional psychiatry, which, as I said, is what I do. It's essentially the practice of psychiatry for a judicially supervised population, which is a nice way generally of saying inmates. And that's where I spend the bulk of my day. So let's talk let's just go straight to that evaluation that I sent y'all. And let me dial it up here. Now, I could share the screen, but I found that since I sent it to y'all, I don't know how useful that is. Sebastian, should I share the screen with people?
I think you're more than welcome to, just so we're following along with you.
Okay. Let me, and I do know how to share screens, even though I'm getting increasingly incompetent with technology. Right, let me share the screen here. How about that?
All good.
All right. Look at that. Okay, so now this looks kind of blurry to me, but my eyes are shot. Sebastian, does this look kind of blurry to you all?
I can read it just fine. Maybe if we can zoom it in the bottom right, it might help a little bit.
Yeah, let's see. Yeah, that helps a little bit, sure.
Yeah.
Thank you. Okay, so this is better than any amount of talking that I can do to show you what forensic psychiatry involves. Most of forensic psychiatry is not the stuff you see on Law and Order, where you have the expert in a coat and tie, charging an outrageous amount of money and being grilled by attorneys. That is a tiny, tiny fraction of what you do as a forensic psychiatrist. Most of what you do is evaluations and then long reports. And so this is a long report. This is a competency to stand trial and an insanity evaluation. So this is criminal forensic psychiatry. I was hired to do an evaluation of somebody charged with a crime, and they had some intellectual difficulties, and there was a question of whether they were competent to stand trial. And this is what you learn in forensic psychiatry. The law requires in all states that people be competent to stand trial. And sometimes if people are acting strange after they're arrested, the judge sees them or their own attorney sees they're not thinking straight, they may request an evaluation for competency to stand trial, and even restoration of competence, which often means the person's psychotic and they'll get better with antipsychotic medication. But in any case, this is a person that I was asked to evaluate their competency and also at the same time evaluate whether they were insane at the time of their uh, offense, their alleged offense. Um, and insanity is also operated in most states by a standard called the M'Naughton standard. It's an old English standard that you would learn in a fellowship, and essentially involves that you're not criminally responsible for behavior that you did if, as you know, you had a mental illness that made you not understand the nature of what you were doing, or if you did not understand that it was wrong due to that mental illness. That's the M'Naughton standard. That's what operates in New Jersey and in most of the states that have insanity defenses. And so, when you're doing a report as a forensic psychiatrist, so I've already done my residency. I know about mental illness. I do a year of fellowship, and what I learned in that fellowship is how to write these reports and how to ask the sorts of questions. So, what is it about a forensic psychiatrist that's different from just a general practicing psychiatrist? Well, first of all, most forensic psychiatrists do also practice clinical psychiatry. Very few people just do forensics. It can really get tiring after a while to just see bad, all these evaluations, often, not all of them, many of them involve bad things happening to people, sometimes bad people, warring people. Folks doing child custody evaluations will know how difficult those are, because you see two parents once in love now fighting over their child, and that's miserable sometimes. But nonetheless, most psychiatrists do both. Forensic psychiatrists typically do clinical work as well. But when you're doing forensic work, there is a premium put on writing skills. So almost always there's a report that's written. So if you don't like to write, just don't do it. I can tell you right now, if you don't like to write, don't do forensic psychiatry. It's just, and some people don't like to write. Writing is both a talent and a skill. Like most things, some people have talent in it, and some people develop skills, and some people have both. But if you hate writing, stay away from forensics, because that's what you're going to be doing. Also, it puts a premium on analytical thinking. So you have to be a good diagnostician. You don't have to be a good therapist. It doesn't hurt to be a good therapist, but you don't have to be a good one, because when you're doing forensics, you're not doing therapy. It's an evaluation for a court, an employer, an insurance agency, a school district, for example, for fitness for duty to do work. And so your purpose is to apply the law to a psychiatric condition that answers a particular psychiatric legal question. So what you have to first identify is what's the psychiatric legal issue? What are the criteria that pertain to the issue? What are the data relevant to those criteria? And then finally, and most difficult and most important, what is your opinion and your reasoning that leads to that opinion? And this is where the analytical thinking comes in. You have to be logical. You have to be able to express your thoughts clearly on paper for an educated layperson. You're not writing like you are in a emergency room. If somebody comes in schizophrenic, and you can see schizophrenic after a number of years, you can see them walking in the door. You know they're schizophrenic. You write quick little notes in there, and you do your consult, and boom, it's done in 20 minutes, 30 minutes. These take hours to write, many hours, and then they often sometimes dozens of pages sometimes. And you're paid for your time to do that. So it can be very tedious too. I'm sort of saying the pros and cons. You have to put everything down there. It's the opposite of writing a novel. A novel draws on, you want to be sly in a novel. You want to not tell the reader everything. That's the fun of reading a novel. The reader figures things out. You foreshadow things. You have wordplay. You can have an unreliable narrator. You have personality in the narration. You don't want that. This just throw all that out. Doesn't mean you can't be both a good novelist and a good forensic psychiatrist. It helps to be a skillful writer, but you really just stick to the facts and explain everything. You don't want to leave anything implied. Okay, so let's go through some of this. So look here, I have a reason for referral and I state what the reasons are and what the questions are. One, two, three. Waive constitutional rights under Miranda, competency to stand trial, and sanity. Identify what the psychiatric legal questions are. And then, unlike like a lot of legal opinions, but unlike most reports we write, I put the opinions and reasoning right up front. Why? Because I was told to, not merely because it mimics what judges do when they publish opinions, but frankly, there's I wouldn't say cynical. There's a very practical reason why I put the opinion and reason up front, is because just in case there's a very busy judge and attorney who don't have the time to read all the data that support my opinion, well, there it is up front. Saved you a little bit of time. Right there, there's my opinion and reasoning. So that's why I do it. Now, that doesn't mean you can get away with not writing your data, because they will call you on it if you try to just do the opinions and reasons and say, well, where's the data? Whether or not they read it, they want to see it there. Okay. So let's go to before we do the opinions and reasoning, that's the fourth step. So we've got the questions, and then we go, like, for competency to stand trial. What are the criteria? And I refer here in competency to stand trial, NJSA. This is a New Jersey statute. This is the law in New Jersey that talks about competence to stand trial, that says what you have to know. And so that's the criteria that I'm using. Let me go back a little bit further down here. I don't want to make y'all nauseated here. I'm going through all the data here of this person, the psychiatric history, social and developmental history. I'm not going to get into all that, but you can see it's very detailed, much more detailed than you would ever do in a report for just your own patient, because you don't need all that detail if you're writing sort of for yourself and maybe for another colleague in your employed practice. Okay, so here we go, competence to stand trial. This is the actual eval that I do. And I say, here are the person's answers corresponding criteria for competence as specified in New Jersey statutes. And I go through the things. What's the date? You have to be oriented. What is the charge against you? That's required for competency to stand trial in New Jersey. And I use relevant quotes. What is the function of a judge? If they don't immediately give a clear answer, I'll ask them to explain again. Sometimes what I'll do is, and this happens quite frequently, is you get people of particularly this is happening increasingly frequently, of people who are not familiar with the U.S. judicial system, often immigrants, new immigrants, who have no criminal history other than this offense. And they're not, and if they're low IQ, they're just not going to know about the U.S. legal system. So some of what you might do is actually educate them about. You tell them what a judge does, and then you can ask a few minutes later to see whether they have any retention of that whatsoever. Some people may require education over weeks to get this. So, but in any case, at the given time, what is the person's understanding? What is the function of a prosecutor? And you don't have to be a genius. So, for example, I say, is the prosecutor for you or against you? And this person answered, some are against you, some not. And then I clarified that a prosecutor is against you in the trial. She was able to repeat that fact minutes later. So the person showing an ability to learn. They need to be able to know their attorney and work with their attorney. That's also required in competence to stand trial. And so I go on and on about this. And in particular, what's often very complicated, which requires in New Jersey, is understanding about a plea bargain. That's a common way to dispose of cases in jurisdictions across the country. And that's something that's often difficult for people to understand who have no familiarity with the criminal justice system. And sometimes, a lot of times, you have to explain to them what that means and then have them explain it back to you. And then you want to know about the relationship with the attorney. Can they work with their attorney? These are what are called the Dusky standards based upon a landmark case in forensic psychiatry. And this is, again, something you learn in the fellowship. Most states have this standard for competence to stand trial. And what you can also do sometimes is you get a lot of forensics is about collecting collateral information. This is how it's also different from clinical practices. Most of the time, unless you're working in a child or adolescent, you're not going to seek collateral information for an adult with an uncomplicated picture. On the other hand, forensic work, you generally do need to contact collateral information because there's a lot at stake in these: money, freedom, child custody, other benefits. And people have great incentive to, if not lie, well, to present themselves in their most favorable light. And you learn very quickly in forensic psychiatry. I will go so far as to say this, and please take this as a heuristic. Do not take it literally, but I've done this so many years, and this I find is quite helpful. It's an exaggeration, but what I teach residents and fellows is, and it's a paradox, I say, listen carefully and never believe a word they say. So you have to wrap your mind around that paradox when you're doing forensic work. You need to hear people. You need to listen to what they're saying. You need to join with them in a sense to draw them out and hear their side of the story. But at the same time, you must, as a professional obligation, maintain some level of professional skepticism to where you're going to need to preferably find support or for that matter, refutation of what they're saying. I would argue that the skill of professional skepticism will also serve you in clinical psychiatry. You don't need to be a forensic psychiatrist to understand that you may not always be told the truth. Look, a lot of times people just forget. People forget that they were on an antipsychotic medication. They may forget how many times they were hospitalized. They forget all sorts of things, short of even trying to feign or dissemble. So a lot of skills that you learn in forensic psychiatry can be applied to clinical work and vice versa, for that matter. So in this case, competency to stand trial, if you're not sure about whether the person can get along with the attorney, call the attorney. Hey, how's your client getting along with you? You work with them? Do they work back and forth and listen to you and take your advice and maybe have sometimes ideas of their own, blah, blah, blah. And the attorneys will tell you. They'll tell you whether the person's psychotic or just obstinate or paranoid. They'll tell you. Okay, moving on. So now we go into insanity. In insanity, there's a law. It's the Manhattan standard, as I said, for insanity. And there's standards about mental illness. And I asked this person because this was not about psychosis, about schizophrenia or bipolar. This is about intellectual shortcomings. So the questions had to do about their knowledge. And I asked very simple questions and sometimes more difficult questions. And insanity is about their thinking at the time of the offense. Competency to stand trial is about how they're thinking now, oftentimes many months after the offense. Do they understand the charges and the situation they face now? Insanity is looking backwards and trying to understand their thinking at the time of the event, which is always a difficult thing to do. So I go through a whole bunch of different questions just to get a sense of her intelligence. And then I came up with some of my own questions about judgment and childcare. Do you let children cross the road by themselves? No, I hold on to them. What could happen if you did not hold them? they could get hurt and fall. I'm asking these questions because this person was in a caregiver position. It was a very tragic event where the person was overwhelmed, and it was unfortunate they were put in that position. So ask a bunch of childcare questions about, and this is kind of how they're thinking now, and at least do they even now, or do they understand? Because in this case, I would expect her intelligence now to not really be much different from at the time of the event. The problem is most insanity evaluations are not of this sort where it's about intelligence. It's about, was the person psychotic? And usually by the time you're doing an insanity evaluation, the person is long recovered from their psychosis because they're on antipsychotic medication, which works usually, and the person's sane again, and they're rational, and they're trying to describe how they were thinking at the time, and you're trying to get a sense of, well, were they psychotic or not, and how psychotic, and then you would get collateral information that would support or refute such an assertion of insanity. Okay, Sebastian, am I boring people enough? Is this are there thumbs up or thumbs down? Is that what y'all do now? You know, you um
Anyone in the audience want to chime in? I think it's a fascinating look into the day-to-day of a forensic psychiatrist.
yeah, I'll take a question or two right now if you have any about, this kind of evaluation that we're doing. If not, I'll
Yeah,
just go on.
if anyone in the audience has any questions, Dr. Reeves, one of the things that I saw was that this was a 2 hour long interview. How does this work? How is the workflow? How often are you doing these interviews, and how much of that time is split into just writing this stuff up?
Most of the time is spent doing the writing. Some interviews can take longer than 2 hours. Some can take four. Sometimes you split them into two different sessions. Um, the You want to come prepared for. Sometimes you need to do psychological testing. You may do it yourself, or you may hire a psychologist to do the psychological testing if that's relevant in a particular case. Um, so the hours can vary, but I'm very careful with my reports, and I spend a lot of time writing, and I put them down for a couple of days. And this is the same with any writer. Anybody who does any sort of professional writing, your first draft is never a perfect product. And you set it down, you walk away for a couple of days, and then you come back and you see, okay, is this really making sense? So there's a lot of revision in doing these reports too. You try to make it very clear what you're thinking. So yeah, these reports can take, easily, 10, 12, 15 more hours to write reports. Let's go to some of the reasoning here near the front. Um, you also give a warning of confidentiality in these, because usually there's limited confidentiality in a forensic report. This is an ethical obligation. You know, People think if you're the doctor, you're not going to say, they're going to spill their secrets to you, but you're going to keep it between them and yourself. Well, this is not the case in a forensic report. And you'd be surprised how many people, even though they're in a forensic situation, somehow think that you're going to say things favorable to their case, and yet you're also going to keep it between you and them, and you can't do that. These reports are invariably going to go, like I said, to an attorney, to a judge, or to both, to an employer, to a disability insurer, some other agency. They're not going to be confidential, or it wouldn't be a forensic report. And so you need to let people know, no matter, you're going to call it like you see it. You're going to be objective. You're not for them. You're not against them. Your job is to answer a question, and you're friendly with them, but you're not kind of their advocate like you are if you're a treating psychiatrist. So that's another difference too. You're not
Now,
their doctor.
Now, Dr. Reeves, I think this is tangential to what you're discussing, and it's a question we have in the chat. Is this sort of per diem work as legal teams sort of hire you, and then you incorporate clinical work and your day-to-day responsibilities on the side? And if this is per diem, how often is a forensic psychiatry called to testify in these types of cases?
Okay, that's a good question about the business of forensic psychiatry. Yes, in a way, it's per diem, and I understand what that person's mean. You're called on a piecemeal, a la carte fashion, and you're called irregularly. You don't know when you're going to get a call. Uh, some people have a very busy forensic practice and do a small amount of clinical work. Other people are less busy and do forensic work from time to time. So it varies, and you set it up as you see fit. You can turn down cases if you don't want to do them. I recommend that you always have a regular income when you're doing forensics because every man or woman is corruptible with the right amount of money. Do not think you're not. Do not think you're above corruption or just say bending maybe the story a bit to please the attorney that's hiring you. So you keep a regular income coming in so you know you can pay your mortgage, you know you can pay your kids' tuition, pay the car payment, whatever. So you're not tempted to take a bad case and say things that you would might regret later. Um, so there's a real sort of self-insurance reason to also keep regular employment. So as I said before, these generally are piecemeal part-time work for most forensic psychiatrists, and you fit it into the other work you're doing.
Now we have another question as well, which is you're clearly very ethically oriented and you have a lot of complex considerations when writing this. But when you're representing a case, how do you strike the balance between empathy and professional skepticism, particularly when writing these interviews?
Yeah, that's a good question. The empathy. This was a particular case where I felt great empathy for this particular evaluee, but you have a job to do, and your job is essentially to serve justice. That is your ethical obligation when you're doing this. Doesn't mean you can't be empathic towards the person, but you're not doing therapy with them. You try to understand them. In that sense, your empathy can be quite useful. But ultimately, you're required to answer a question that the law asks, and so you have to be, I wouldn't say cold, but you have to answer the question. And so it is not uncommon for me to be answering questions in a way that I would prefer not to, but this is what the answer is. This is the data I have, and this is answering the question that the law asks. I don't know if that's uh, answering your question. And I would say if you're, well, here's what I'll put it this way. Um, I know people that are better therapists than me, many people, including my wife, who's a child psychiatrist. Um, and I don't have, temperamentally, I've learned to have skill with patience, with C, Patience. Um, and to be a good therapist, you have to have a lot of patience. And I would say a good amount of empathy for people. It helps. That is a professional skill. And so there's some people who are better therapists and they tend to be more empathic. And as my role as director of psychiatry, I hire people who I can tell are going to be good therapists. That's who I want. As a forensic psychiatrist, you don't have to be the best therapist. Doesn't hurt, but that's not what this particular subspecialty draws upon.
Dr. Reeves, so we have another question here, and I think this gets to the core of forensic versus having employment in a correctional setting, such as a prison and or jail. But how do you personally balance your time between this forensic work and or correctional psychiatry work? And in the correction setting, do you find that you have the capacity to build therapeutic relationships with incarcerated patients?
Uh, I would when I with somebody saying whether I would say I'm an administrator now. So I was a competent clinician, and so then they bumped me up to the level of administrator to see if I'm competent to do that. Uh, and for the people that are the line clinicians, at least in our system, yes, you do have the opportunity. We have social workers and psychologists who are doing most of the therapy. Nowadays, as psychiatrists, in most employed positions, you're paid for your expertise that you have that others don't, and it's just changed. and I went through this change, and you're going to be doing mainly diagnosis and medication management, and probably leading the rest of the team. You might get some opportunity to do psychotherapy, but there are people that are paid less than you, uh, and can do it probably many times just as well as you could, or that's what people think. And so they're going to be doing that work. Those are psychologists and social workers. So, yes, in particular, our social workers and psychologists in our system get plenty of time to develop therapeutic relationships with people, and that can be very helpful. And frankly, I argue that, and this is true in the literature too, that therapy, when it works, is better than medicine because therapy sticks with somebody. They learn skills, they learn ways of adapting. Uh, and a pill is not curative, it works while you're taking it. And if you stop it, the depression may return, the psychosis may return, the anxiety may return. I'm a big believer in therapy. Um, and, uh, and if you're lucky enough to craft a position in psychiatry, would probably be in private practice where you can do both therapy and medication, go for it. Um, uh, that's that's increasingly unusual. I'm sort of veering off forensic psychiatry and giving sort of my opinions about the field.
I think that's actually perfect, because one of the students wanted to know, how did you decide to actually pursue forensic psychiatry, or what got you initially interested?
Oh boy, um, what got me interested? Um, the I did my fellowship in the Village in New York City at the erstwhile St. Vincent's. Um, it was in the Village there. Um, I did my undergrad at Princeton, went back to Texas for med school because that's where I grew up. Came back up to the city because I enjoyed living up here, and did my training there. And then I left, and I came back to do the fellowship when one of my mentors was starting a forensic psychiatry fellowship, and I learned a little bit about it. And here's what I thought, and I'm not ashamed to say it because this is what motivates a lot of people, even though we're not supposed to admit it. I knew that forensic psychiatry, when you're doing forensic psychiatry, you get paid more per hour, more or less than you would if you were seeing patients. That's not so much true anymore because there's a lot of forensic psychiatrists out there, and the law of supply and demand. I think our premium has gone down a bit much, but there was the element that my pecuniary interest there of making money. So that was part of it. Uh, but it wasn't just that. It was also um, understanding that it it paid people to be inquisitive, sort of like a detective, and you'd have to write a report. I'm a good writer, and I enjoy writing, and I know I'm a good writer, and I knew that this you'd have to write reports, and uh, and in that sort of detective work, also say trying to assess, is this person, is it really happening the way this person's saying it, or is there another side to the story? You're a detective in a way, and I enjoy doing that. Trying to peel back the onion and see what's really going on there. And some people don't like that. It's not their temperament, and and in the same way, like I said, I am not the most patient person. My patience is a skill I've learned, and this sort of suits my temperament. And I find that we all eventually sort of find the level that we belong at, hopefully through your own conscious choice, but if not that, then then the force will find you and put you in your position. For fans of Star Wars. Other questions?
So Dr. Reeves, what advice might you have for medical students that are looking to figure out whether or not this field is for them? How can they get involved? And if not at the medical student level, what should they look for during residency in order to figure out whether or not forensic psychiatry is for them?
Um, okay, good. This is interesting that these questions are tending towards career. This is fine. I've done this before, and this is what's happened before. This is sort of, I show you a report and then we veer off into career advice. That's fine. Again, take it. This is one person's opinion, and there are other people with other opinions out there. Um, I didn't know about forensic psychiatry until near the end of my residency. So, and I learned about it when I learned my mentor was starting a fellowship, and I started thinking about it because he actually called me and wanted me to be one of the first fellows because he knew I'd be good at it. And I went back to the city to do the fellowship. Um, so uh, I didn't know about it in certainly med school, never even heard about it. Residency, not until like the fourth year that I learned about it. Y'all are in med school, so you're way ahead of the game. Uh, if you're at all interested in forensic psychiatry, things you might want to consider, I'm going to state kind of the obvious. You might want to choose a residency that offers a forensic psychiatry fellowship. Same, this would be the same if you wanted to do child or addictions. You tend to get a leg up to get into that fellowship if you've done the residency there because they know you. And if you're competent and reasonable and a nice person, and can get along with your supervisors, you stand a better chance of getting into that particular fellowship. So that's a consideration is when you select a residency, think even further down the line to have a fellowship that I might be interested in doing. As far as experience in forensics, the ACGME, which is the accrediting body for general psychiatry residencies, requires vaguely a forensic experience, but that's almost so vague as to be meaningless. If you want to get yourself some experience that would convince a training director like me that you're serious about it, you would want to, in your residency, get a forensic experience. So that might be writing something as simple as a case report that involves a legal issue with the patient. It might be doing a poster with the forensic psychiatry training director or some other forensic psychiatrist in the community. It might be shadowing a forensic psychiatrist in the community while they do their work. It might be doing a rotation at the state forensic hospital or hospital. Most states have forensic hospitals. Do an elective or a rotation there. You could also do a rotation at a jail or possibly a prison. And so you'd have to reach out. You might not be immediately told yes. It is difficult to sometimes to get people into prisons and corrections, and people's time is limited. But yeah, you reach out to these specialists, and you show your interest in the field, and you also show whether you also find out for yourself if you like it. It's not for everybody, and even as I'm skilled at it, I would not want to be writing reports day in and day out. In fact, my private practice is now a small part of my practice I keep because I'm a training director, and so I have to be able to do what I teach. But I'm very busy running this statewide mental health system in corrections. And I'm doing research too. So I'm doing a lot of things. I've reached where I want to reach, and forensics is part of that.
I want to open it up to see if any of our audience members have live questions they would like to ask. We have still a number of pre-sent ones from our Google form, but anyone, the floor is yours. And if our audience is a little shy, I'm happy to continue here. Now, Dr. Reeves, we know you mentioned sort of, loving and or tolerating writing as is an essential thing that tells you whether or not forensic psychiatry is for you. But what about other skills such as public speaking in the courtroom? Are there any ethical concerns about representing quote unquote evil people or having to listen to very traumatic situations?
Um, see, yeah, well, yeah, evil people. I work in corrections, so um, you know, such as there's evil in the world, however you may define it, you're going to see some of that, probably more of it in corrections than elsewhere. Although, as you probably know, there's plenty of it elsewhere out there of in the world as well for people who never get convicted of anything. Um, but you're not representing the person. you're representing an opinion. You're evaluating a person, for example, here, competence to stand trial. You're seeing whether they have uh, the cognitive capacity to face their charges. So you're not representing them; you're representing your opinion, and so you have to be able to separate yourself from perhaps, there's some, I'll say it, there's sometimes some very uh, you know obnoxious would be charitable, but yeah, really unsavory people that you evaluate. That's your job. That is your job. Somebody's got to do it. That's your job. Police officers have to do this all the time. Police officers have a very tough job. I would say it's tougher than what I have to do because they're in the moment. People are, it could be physically dangerous. So you have to be a professional and do your job, uh, and answer the legal question. And if you don't like working with criminals and you find them obnoxious, and look, I find many of them obnoxious. They tend to be a lot nicer when they're sober. I found in prison, people get sober, everybody gets a lot nicer. Um, but that's what you have to deal with when you're doing forensic psychiatry. What was the other one about public speaking?
Yeah, public
Yeah,
speaking in a courtroom.
well, of course, if you're good at public speaking, that's what testimony is. It's public speaking. But that's a skill you can also learn. You can learn partly in a forensic fellowship. Again, I think it's also a talent. Uh, you know, who's got the gift of gab and know when to shut up, know when to speak up. Uh, so that can certainly help. But you know, I would not worry about public speaking so much to be a successful forensic psychiatrist. You can largely, for the most part, avoid a lot of testimony unless you put yourself in those situations of very high-powered cases uh, where you sort of are drawn to that. But you can learn it as a skill, public speaking. I, I'm much less concerned about somebody who's somewhat bashful than I am by somebody who can't write.
Now, Dr. Reeves, we have a couple questions specifically regarding, I think, your own mental health and whether or not it took you a while to emotionally adapt to the environment that is forensic psychiatry or corrections. And in your daily life, how do you go about safeguarding your own mental health?
Uh, well, yeah. It can be very stressful. But it's not the private cases that are stressful. It's my correctional work. I'm an administrator. I'm, you know, that's forensic in the sense of I'm a forensic administrator. Um, that is quite stressful, and sometimes I even think like, why am I doing this to myself? Um, but I'm good at it. Um, and with an administrator in a statewide system, it could be true in not just corrections, but a big hospital administrator. You just get hit with stuff all the time. That's a high level administrator. You just get hit with problems, and 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 that can be very stressful. So it is stressful. There's just no way around it. Um, I think some people are better at handling than others. They just don't get anxious. I'm generally tend to be somewhat anxious, so I get more stressed about things, worry about things. It helps to have a cooler temperament and just not be an anxious person. Because look, it's not the situation that's anxious, it's your reaction. You see, now I'm doing therapy for y'all right now. you know, it, it is you who is becoming anxious. So if you can control yourself, this is where you learn mindfulness. This gets into religion and inner peace and renunciation of desire, etc. So, and preferably if you have a calm temperament. So I'm avoiding answering the question. What do I do? Uh, uh, I exercise. I lift weights and I exercise. I'm in very good shape. I'm 59. I go to the gym every day. I'm going to go to the gym now when I'm through here in a couple minutes, and I keep myself in very good shape. And I urge you never to tell your patients to exercise like you all do, because then they're not going to need your services. So never tell them to exercise. I think exercise is a great antidepressant. It really is a wonderful thing. And people have their own ways. I have a family I love. I have children that I love, and I think family, at least for me, I think it's essential. It keeps me grounded. Uh, I garden. My flowers will respond to my gentle ministrations when my patients won't necessarily all get better. Uh, Gardening is also something that I enjoy doing. So you got to find something to step away from the work. You absolutely do.
Yeah, so Dr. Reeves, this question's unavoidable. I've seen it come up multiple times. Specifically questions regarding safety. Do you view as testimony in custody cases as being dangerous, and or have there been times in your professional career where you felt physically unsafe due to something like threats? And is that factor of safety something you should consider before pursuing a career in forensic psychiatry?
Um, yeah, that comes up a lot, but the I shouldn't say I hate it when my kids say or when they say I mean. So just stop me and like metaphorically slap me if I say or I mean. Uh, it's just ugh. All right. Um, as far as danger goes, I find that the most dangerous place that I was in an emergency room. Emergency rooms, you don't know who's walking through the door. They're often psychotic, intoxicated, withdrawing, all three, angry. Emergency room, uh, and that's in a general psychiatry residency. So, and I trained in the village too, and I had a lot of fun there. A lot of diverse people. I come from a pretty conservative background. Uh, I loved working there. I saw all manner of psychopathology in the village in New York City. It was a lot of fun. And but it was at times, people took a swing at me. Not often. I didn't provoke them, but that would happen. Um, and then secondly, on a ward, I've had to tackle some people with texts before when I was in residency. Um, I, I was bulked up more and stronger than I am now. I'm not so sure I would do that now. I let somebody younger, such as yourself, do there while I would supervise you tackling the person. I tackled this poor big guy, and he was attacking the tech, and I was the guy there. I had to tackle the guy, and I tackled him. I felt like a rough and tumble guy until the poor guy started crying as soon as he was on the ground, and then I felt like a heel. He was just scared, um, but that can be violent. I've seen in a forensic ward, somebody was chasing me around a table once, but I was faster and I could stay around, a set of tables until the techs intervened. But I've seen them hit techs, and I saw one guy really got, hit hard one time by a antisocial patient. This is a long-winded way of saying, finally, in corrections, I find corrections are frankly safer for a psychiatrist than any of the other three places that I mentioned. I don't think there's any study. I've not seen a study that assesses, attacks per capita for a psychiatrist in a correctional versus other setting. But I think other forensic psychiatrists I've heard say the same thing. In corrections, you're the good guy. You know, in a hospital system, in an ER, if you're going to commit somebody, you're both the doctor and the jailer. They don't like that. In a prison system, you're not the jailer. At the very at the very least, you're a nice person to talk to. Maybe you prescribe meds that make people feel better. So I find it's just safer for us in corrections. Now, you don't want to be stupid. Uh, you don't want, but you don't knowingly put yourself in a situation. But yeah, I am confident that I feel and my colleagues feel safer working in corrections than they did during general residency training. Ironically.
Now, Dr. Reeves, I think we have time for one last question. And this comment specifically comes from an individual who wants to learn about whether or not in your training you had formal learning about violence/aggressive behaviors that eventually lead to crimes. And specifically, they're asking because they're interested in the motivation or profiling of individuals who, for instance, engage in mass murder, and or if there's a lot of overlap in policy work for those reasons.
Okay, that's sort of a complicated uh,
I
question.
guess I guess do you learn about upstream outcomes to downstream criminality, and if there's a policy lens to forensic work, I think is what I'm
Okay,
getting. Destiny, you can
so
unmute if you wish.
okay, so I'll address it at several levels. At the level of the fellowship, and in my fellowship as well, routine, you're trained to do violence risk assessments. Basically, you learn predictors of violence and you assess people whether they have these factors or not. And then you make predictions about whether somebody is likely to be violent again. So that is bread and butter forensic fellowship stuff, violence risk prediction. So you're taught various structured assessments, both actuarial uh, and just structured uh, to offer those sorts of opinions. So that's straightforward forensic psychiatry fellowship 101 that you will get that training. Now, as far as um, policy work, that's an interesting question. If you're interested in policy work, I do think forensics kind of gives you a leg up because you learn about the law and you learn about the levels of the legal system, short of being an attorney. So I do think people are interested in policy. I do think forensics, for choosing a subspecialty could be quite helpful. You don't have to be a forensic psychiatrist to get into advocacy or policy work. If you're interested in that, go straight to your psychiatric association, whether at the state or at a local level. Um, and 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 your American Psychiatric Association is always hurting for people who are interested to do policy work. That's where I would just go straight there, whether you do forensics or not. I've done some advocacy work. I helped get a law passed in New Jersey, very, very small level. But that was, it had my forensic expertise in the background, but it was through the state psychiatric association. So I would use your professional organizations because they often lobby legislators, and you get if you enjoy doing that politicking, talking with legislators and lobbyists, your psychiatric association is the first place that I would recommend you do that. And again, forensic expertise can serve as useful background information for that. But don't wait to get a forensic fellowship. They would love to have somebody willing to do work with your state psychiatric association. There's just not enough people willing to put in the time, including me. I've sort of faded out of that because I'm just too busy doing other stuff.
I have included a link to the American Academy of Psychiatry and Law. Membership is free for our medical students if you're looking to get involved. Dr. Reeves, I want to be respectful of your time. We are a little bit over